Welcome to a program featuring interviews of state and federal candidates, as well as the incumbents from districts served by Clatsop, Marion, Polk, Tillamook, and Yamhill counties. I'm Ruth McEwen, an advisory council member serving Northwest Senior and Disability Services Advisory Council. I want to welcome candidates, incumbents, and advisory council members to the 2022 Candidate Forum, which is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grants-funded programs. The mission of the Northwest Senior and Disability Services is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide consumers include information and assistance, in-home and community-based services, and financial and medical help, meal sites and home-delivered meals, option counseling, adult protective services, Medicare counseling, peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to be interviewed. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member of the advisory councils. Then each candidate will have the opportunity to answer questions which will be timed. That way you, the viewer, can compare apples to apples. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disabilities.
Hi, my name is Stephen Meneses. I'm a volunteer with the Senior Advisory Council and Northwest Senior and Disability Services. Today I'm interviewing Mary Cook. She's a Democratic candidate for Congress, House District 11. We'll be asking 5 questions related to seniors and people with disabilities. Welcome, Mary. Thank you for sharing your time.
All right, thank you, Stephen.
The first question we wanted to have answered is, tell us about your platform, an experience that would encourage a senior or person with disabilities to vote for you.
Well, thank you for that question, Stephen. First of all, I have to say that my platform is in alignment with the Democratic platform overall. And I believe in advocating for much needed safety nets, including Medicaid and Medicare, and the services that go along with that. I personally know individuals who rely on those services, and I know how much they are needed. And I have to say that I understand that Medicare and Medicaid are under fire right now as far as wanting to go to be privatized. And from what I understand, it is not necessarily a good thing. What it is, from my understanding, is personal investors who will basically, it's about profit over patients. And my concern is that we need to keep Medicare and Medicaid as a federally funded or program. And I will work to keep that in place for seniors and those with disabilities. So tomorrow there's a rally down at Albany Courthouse for about healthcare for all Oregon, and I think I'll be there because I want to learn more about it. So I guess the I think the American is it the American Disabilities Act? No, it's not. It's in any case, they're celebrating their 50th anniversary tomorrow, and I believe it's the ADA, American Disabilities Act, is celebrating their 50th anniversary, and so I want to be there for that. So as far as privatizing Medicare and Medicaid, I don't think it's a good idea. I think that private investors, they will probably receive profit of about 40%, whereas currently we are, the federal government only receives about 2%. So of the taxpayers' money to go back into the program. So anyway, that's where I stand. I'm all for keeping Medicare and Medicaid as a social service provided by the federal government.
Thank you, Mary. Second question is, tell us what you know about LPI and how it improves the lives of seniors and people with disabilities.
Thank you for that question, Stephen. First of all, from what I understand, OPI stands for Oregon Project Independence, which is a great program that offers seniors and people with disabilities the opportunity to remain in their home. And it actually cuts the cost for Oregon and to have these individuals stay in their home as opposed to a nursing home or a facility that would cost a lot more money. And the individuals are allowed to pay on a sliding scale, which is great for the recipients. And also, from what I gather, it also offers activities for daily living, including medication management and like examples like shopping or just even daily chores. So it's a great program, and I think that it was a wise decision on the part of Oregon to institute this program.
Thank you, Mary. Third question, how would you prioritize state funding, including funding that is matched with federal funds, such as Medicaid, for services to an increasing senior and people with disabilities population?
Well, like I said earlier in my question, the first question, I would be a major advocate for protecting Medicare and Medicaid from becoming privatized. And I don't think I addressed this in the first question, but in a private insurance would decrease provider choice. It would increase copays and deductibles, and sometimes it would have inappropriate denial of care. So I think that it would behoove us to keep the traditional Medicare in place. I would be an advocate for providing or keeping incentives for environmental modifications, such as wheelchair ramps or different things that make it easier for seniors and those with disabilities to live their daily lives. I would make sure there's an adequate amount of funds from Medicare, Medicaid to provide these things. And so Yeah, so I'm hoping that Medicaid and Medicare will provide those services for those people who have those disabilities and are aging.
Fourth question. During this time of increased risk of homelessness and food insecurities, what will you do on a state level so that seniors and people with disabilities no longer face a lack of accessible, affordable housing and receive appropriate nutrition?
Okay, well, first of all, if I was elected your state legislator, I would do my best to provide incentives to developers to build low income, affordable housing and for seniors and those with disabilities. And that's part of my platform, actually. Homelessness is a problem that can no longer be ignored or dismissed as it needs to be addressed. And as far as nutrition goes, I would say I would like to keep in place programs like the SNAP program, the Supplemental Nutrition Assistance Program, and of course, Meals on Wheels is also a good program. And it's important to keep these policies that allow caregivers the opportunity to utilize the resources that Medicare and Medicaid provide in order to purchase food items for seniors and those with disabilities. So also, not only that, but to help provide transportation because that's an issue. And of course, we've seen that, as far as the pandemic is concerned. So we need to get those seniors and those people with disabilities out into our society and let them be able to enjoy life just as much as we do. Thank you.
Thank you, Mary. Our final question, the fifth question. What would you do as a legislator to address the behavioral health issues that have been brought on by health issues and isolation related to the pandemic?
Great question. I feel as though, and I've experienced this from people I know personally, that the pandemic has caused a lot of loneliness and possibly depression at times. And I advocate for programs like OPI, where we can have people come in and spend time with them and address mental health and behavioral issues. Programs like Visiting Angels to come in and provide activities, also activities through the senior centers here, and also more education and training for caregivers to more on behavioral specialists, to create more behavioral specialists and to increase to meet the increasing demands that have come about because of the pandemic. So there's also the Oregon Intervention Systems, OIS training and certification, more accessible to programs and families, and require caregivers and educators to be trained in trauma intervention care. So I'm an advocate for policies that safely keep activity and employment programs open for individuals with disabilities. So all of these things combined to be able to have access to having the freedom to go out and in public, and like with the senior centers, they offer a tremendous amount of opportunities for those seniors and people with disabilities. And I'm a major advocate, and I hope that they will continue to provide those services. And I had it in my power as a state legislator, I would advocate for those things to continue.
Well, Mary, thank you so much for answering some of these difficult questions and spending a portion of your day advocating for seniors and people with disabilities. And just giving the gift of your time. So again, this is Mary Cook. She's running for House District 11 as a Democrat. Thank you so much.
Thank you, Stephen.
You're welcome.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and the Disability Services Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. Copies of the interviews can be checked out from Northwest Senior and Disability Services by calling 503-304-3451. Again, that number is 503-304-3451. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, please call 1-866-206-4799. Again, that number is 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for the production of the forum. Thank you for watching.